Rabies is a viral disease that causes inflammation of the brain in humans and other mammals. Most cases of rabies caused by dog bites, but in Americas, bat bites are the most common source of rabies infections. Symptoms and incubation period. The period between infection and the first symptoms is typically 1 to 3 months in humans. As short as 4 days and longer than 6 years have been documented, depending severity of contaminated wound and amount of virus introduced. Initial symptoms are non-specific, such as fever and headache. As rabies progresses, symptoms can include partial paralysis, anxiety, insomnia, confusion, agitation, abnormal behavior, hydrophobia, paranoia, terror, progression to delirium and coma. Death usually occurs 2 to 10 days after first symptoms. Rabies is caused by a number of lethal viruses, including rabies virus and Australian bat lethal virus. The route of infection is usually by bite. In many cases, the infected animal is exceptionally aggressive, exhibits otherwise uncharacteristic behavior. After infection, the virus enters peripheral nervous system and travels along the afferent nerves towards the CNS, central nervous system. When the virus reaches the brain, it rapidly causes encephalitis. The prodromal phase, once the patient becomes symptomatic, treatment is almost never effective and mortality is near 100%. Following can help reduce the risk of contracting rabies. Vaccination dogs, cats, and ferrets against rabies, keeping pets under supervision, not handling wild animals or strays, contacting an animal control officer upon observing animal if the animal is acting strangely. If bitten by an animal, washing the wound with soap and water for 10 to 15 minutes. Treatment after exposure can prevent disease if administered properly. The Centers for Disease Control and Prevention recommends people receive 1 dose human rabies immunoglobulin and 4 doses of rabies vaccine over 14 days period. The first dose of rabies vaccine is given as soon as possible after exposure, with additional doses days 3, 7, 14 after the first. Vaccination after exposure is highly successful in preventing the disease if administered properly.